So that is a significant drop in terms of what, and by the way, this was not marijuana of now. This was 1985, 1990. These kids at that age and when they were teenagers were using marijuana. There were more, other surveys obviously have shown more poor academic results, 4 times more likely to have lower grades, even when you control for, again, other drug use, parent life, etc. So we're seeing this now in schools much more. So like I said, dropping out of school, unemployment, social welfare dependence, lower self-reported quality of life is another really interesting one. You ask marijuana smokers now, who regularly smoke marijuana in their 30s, you ask them about their quality of life, and you control for the other things I talked about earlier, and then you ask people who don't smoke marijuana now and who weren't persistent, and the ones that do self-report a lower quality of life than the other ones. We know that, certainly in states like Michigan, but this is relevant all around the country, but I would think even more here in terms of the issue with employers. And now employers are paying for extra, for this increase in marijuana use. They're paying for it in terms of absences, tardiness, accidents, comp claims, turnover, etc. Finally, on this first myth, we'll just finish rounding out the driving thing, because when you ask kids about driving and marijuana on the Monitoring the Future survey, and I don't know if you asked that here in Michigan with your local survey or not, but a lot of kids think that marijuana is much safer than alcohol for driving. And we know that about 10 to 15% of high school seniors report that they recently got into a car or themselves were high, or they got into a car with a driver that was high on marijuana, and they didn't think anything of it. Well, that's a real problem, because when we look at all the studies done on motor performance and driving, and in fact, the most rigorous study, this is in black so you can't see it, in the Journal of Epidemiology, found that after looking at dozens of studies done on driving and marijuana, they whittled them down and concluded that essentially marijuana intoxication doubles your risk of a car crash versus not being intoxicated. So that's a huge finding from the epidemiological journal. Let's go to the second myth. And I'll rely on Liz and others to tell me when we need to break for lunch. So how many have heard that marijuana is medicine? Right? Okay, everybody, right? This is the whole thing. Smoked or eaten marijuana is medicine. We have the term medical marijuana is in our lexicon now. There's really no turning back. And, I get asked this question a lot, and it's a bit of a nuanced answer, but I think it's pretty clear. We know that marijuana has some medical properties, okay? We know that that is true. However, just like we don't smoke opium to get its medical properties, we don't need to smoke marijuana to get its medical properties. That's really the bottom line. We need to make a distinction between raw marijuana, 500 components, the flower, the leafy substance is what you smoke, versus the components in that plant that could have medical value, right? So that's why, it's not contradictory to have somebody, out in a wheelchair saying that they're on their last legs of life and marijuana helps their severe neuropathic pain. That person's probably not lying, but it's also but it's also equally disingenuous for people to say that all marijuana use is medical, and really to derive that medical component, you have to smoke it. It has to be sold, by the way, not at a pharmacy, by a kid with absolutely no medical experience, which is how it's being sold now. And so it becomes a political football as opposed to in the scientific sphere. And that's my biggest beef of it. So, no smoked or inhaled raw marijuana has never been found to be medical. Yes, there are marijuana-based pills, by the way, available now. I'll talk about that in a minute. And other medications actually coming very soon. And actually, the maybe part is the most interesting part. Research is ongoing in this issue. This is not my lecture on the history of opium and cannabis in the early 1900s. It's probably too early for that. But if I were to give you that lecture, you would see that opium and cannabis were equally undiscovered in 1900 as in terms of its pain-relieving properties. Science went the route of opium in terms of exploring opium very quickly. For a lot of different reasons we won't get into, historical, otherwise, other reasons. And there was a quick and fast distinction made between, heroin or smoking opium, like in the opium dens, and these opiate-based medications that we have on the market today. There was no confusion there. Cannabis was ignored. It was not seen as something that was going to have medical value until really the 1960s. After it had been illegal, you couldn't really research it. It was all about smoking pot. The whole, it was tied in with all these cultural issues with Woodstock and Vietnam and Nixon, all of these things together. And by that point, studying it was really difficult in an apolitical environment. And so, you basically have these anecdotal reports in the 1980s of people with AIDS saying, wait a minute, this is the only thing that makes me eat. And people with cancer, some people with cancer, very small minority, but some saying this does help with my neuropathic pain, and you're saying it's not medicine. And so the result of that has been kind of this mishmash of what we have today. And we don't have this with opium. We don't have this with opiate-based medicines because it went a very, very different route. Smoked marijuana has never been not only not approved, but just has been discouraged by every medical association you see here and virtually every major medical association in this country. That the idea of smoking a raw plant and burning something is just, we don't smoke any medicines. And so smoking anything is just an improper way to receive the benefits. Now, some people say, well, you don't have to smoke it. You can vaporize it. By the way, we don't vaporize anymore. Or you could, put it in a brownie, etc. But still, that's the raw component of that plant, as opposed to the isolated components that can be reproduced easily. Like I said, when I say there have been studies showing the components of marijuana are medical, well, we have a marijuana-based medication today. We've had it for over 25, 30 years called Marinol. Have you all heard of Marinol before? Dronabinol. Marinol is essentially THC, right? What gets you high, just synthesized in a lab so that you can reproduce it easily and turn it into a pill. And it was really brought in the early 1980s with the AIDS epidemic, with neuropathic cancer pain. THC, we all know marijuana gives you the munchies. That's true. It's because it stimulates the appetite. So THC does that. That's the ingredient in marijuana that stimulates the appetite. It would make sense that if you're dying of AIDS at a time when we had no medication for AIDS, and so one of the things that was killing people was the fact that they would just waste away and they could not hold food down, that it would have been something that could be very helpful. So that was approved in 1985. It's available in capsules today at your pharmacy, fairly easy to get. And actually, other medications are being developed as we speak, and I actually argue they should be developed faster. I think it would benefit everybody. But one of the medications that's actually really a well-known product in Europe, as well as Canada, but it's about to be approved here probably the next year or two, is called Sativex, and that is essentially a oral mouth spray. And what's interesting about Sativex is remember CBD I talked about 20 minutes ago? Well, CBD doesn't get you high. So what they thought, what the small research company in Britain did is basically take the THC and the CBD, put it together into a liquid with a couple of other very, very minor components of marijuana, extracted the marijuana, but really the THC and the CBD were the highest by far concentrations in that substance, in the liquid, and put it into an oral mouth spray. And today it helps, the THC helps neuropathic cancer pain. We talked about what THC has, the pain relieving properties. And CBD, and who saw the Sanjay Gupta special? Many of you. I'm going to talk about that in a minute because that's actually what he focused on, was not on smoked marijuana by and large, it was CBD. CBD does not get you high, it takes the high away, but it has been shown to help with muscle spasms, especially folks and kids with uncontrollable epilepsy, for example, epileptic seizures, spasticity due to multiple sclerosis, that sort of thing. So they put that together and it actually doesn't get you high. So you would think that would sort of be the end of the story, right? Like, yeah, this is our medical marijuana. What do we need these ballot initiatives for? Well, unfortunately, the ballot initiatives really are about saying that medical marijuana is this picture, right? The compassion. I mean, how many of you remember when Michigan was going through this? This is all about compassion, right? It was all, God forbid, if your parents would ever be, this is the way it was sold. If your parents would ever have cancer or anything else and they needed this, they'd be a criminal, right? Because we're always arresting the person that looks like that. They would be a criminal if they had marijuana. That's the way it was sold. Well, 15 years later, we actually found the reality is the average patient actually looks like this guy, not the guy you saw before. That's not just an anecdote. Those are according to studies. The average user today of quote-unquote medical marijuana is a 32-year-old white male with a history of drug and alcohol abuse. Most have tried cocaine even in their lifetime. No terminal illness. I mean, there hasn't been like this. I thought, well, maybe there was a huge, massive spike in, extreme cancer pain among the 32-year-olds set in California. No, not really. I guess they all had lower back pain all of a sudden, but there was definitely a lower back pain spike. And by the way, almost 90% of them tried marijuana before they were age 19, right? So this is a group that knew marijuana, except now you could get it with your card. and you could call it medicine. In Colorado, less than 2% report cancer, HIV, glaucoma, multiple sclerosis, ALS, Crohn's disease, any of those horrible, terrible illnesses and conditions that are in your law, by the way, that you see in the very beginning, that when you read that, and I don't know anybody other than the county clerk that reads every line of a law, even legislators. So when you read the first couple lines and you read those horrible illnesses and diseases, which God forbid may strike you or your family, or you know folks that have had them and they're horrible things, who wouldn't vote for something like that? I mean, who wouldn't want anybody to have anything, even if it was heroin, to make them feel better if they had a couple of months to live? Okay, I don't think anybody in this room would deny that. But that's not what this is about. You read the last line and it says, and any other illness for which the marijuana is medical. Well, the any other illness really takes the cake here. It's over 90% is chronic, severe, or moderate pain. In California, a recent survey of a couple hundred people with cards showed that 56% of them, their primary condition was a headache. 44% of them, the primary condition was anxiety. A DEA agent recently went and they busted a clinic in Southern California, and he went undercover and he went with his dog. And he said his dog has pain and it gives him anxiety and it keeps him up. He got a medical marijuana card in less than 5 minutes. So it's a joke. It's like, it's really, it has turned into a total joke. But, for those of us, again, who have followed this, we're not very surprised. As early as 1979, the head of the marijuana lobby basically said, we will use medical marijuana as a red herring to give marijuana a good name. And by the way, they have done that with tremendous success. I mean, those of us, I come before this issue in prevention, I mean, we would be desperate we are desperate to have a PR firm like that. I mean, we got to hire whoever they hired, because that's incredible. Imagine the effect you could have on kids if you use those same kind of statistics and tactics. I debated the new current head of NORML on CNN recently, and he said, Kevin, the sky hasn't fallen. This is before they legalized in Colorado. The sky hasn't fallen. In California, marijuana has been de facto legalized under the guise of medical marijuana, as you know. So now it's just kind of out there in the open. I mean, it's sort of readily admitting that this is what we have here. We have had the de facto legalization. And what does that mean with medical? Well, we know the studies show that in states that have medical marijuana, especially those with dispensaries and home cultivation, those two things, because we have to know not every medical marijuana law is alike. I mean, New Mexico and Rhode Island have a few hundred people in their program. Colorado and California have a few 100,000 people. It's very different when you have that scale. But essentially, the studies found that the way to make them distinct, dispensaries and home cultivation were positively associated with marijuana versus the states that didn't have those two things. And that was when they controlled for other things, and they looked at multiple data sets to basically come to that conclusion. So we know in states that have medical marijuana, especially dispensaries and home cultivation, they have higher rates among kids as well. So I ask you, really, are these dispensaries serving the sick and dying? I mean, I don't understand why we have created a completely separate system for marijuana. I don't even care what it happens to be marijuana. It could be LSD. It could anything, drug X. We have created a separate system. We have brought it out of the pharmacy, out of the hands of pharmacists and physicians, to a totally separate system governed by legislatures that are politically influenced and have major turnover, to set up a dispensary system to run parallel with the pharmacy system. If this is medicine, we need to be selling it at pharmacies. The problem is it hasn't been found to be medicine, and that doesn't work well with the legalization agenda. So I just don't understand why we've made this exception. The other question I would ask about this is, do we even think it serves those that are sick and dying? I mean, I've had members of my family that have had cancer. It's not pretty. The co-founder of our organization, Project SAM, Patrick Kennedy, everybody in his family has had cancer, very publicly. We wouldn't deny anybody with cancer anything they wanted, but do we think that people that actually do have those chronic, severe, terminal conditions, that when they need what makes them feel better, we should have them bypass their doctor, bypass the pharmacy, and go down to the strip mall look for the neon sign that says cash only, with the 400-pound bouncer guarding the couple 100,000 they have in cash in the back, because they're all targets of robbery, to get your super silver haze sold by the 20-year-old with no medical experience? I don't get how that's compassion. And yet we have been very easy to say we want this. because when you have it on a ballot measure and it says, should the sick and dying get marijuana, you don't think of the 32-year-old male, you think of the previous picture of the elderly lady. And again, brilliant political move, but extremely disingenuous. We have bypassed the FDA process completely. We've basically said for this one substance, not for any other substance, but this one substance, we're not really worried about safety standards. We're not worried about looking at the benefits and risks of the drug, worried about how it may interact with other drugs. I mean, that 20-year-old kid with no medical experience, he doesn't know what other drugs you're taking. Do you think he can tell you if the other drug that you're taking for your heart medication is going to contraindicate with marijuana? Could care less. We don't know the standardization. You can't standardize batch-to-batch consistency of smoked leafy marijuana. That's why we have pills, patches, injections. That's why we don't smoke any drug, because good luck getting a dose and a standardization of that. Monitor side effects. There's none of that going on. And identify safe drug administration. In this case, we've identified smoking, which is unsafe. Vast majority smoking. So we have bypassed that entirely. Now, again, the government is researching marijuana-based medications. And in fact, there are 288 programs currently looking at the components of marijuana and what benefit they might have. How many of you heard that we need to reschedule marijuana? That would be the way to work with marijuana. There's some nodding heads to that. Scheduling is really a red herring. It's completely irrelevant. Cocaine is a Schedule II drug. I don't know if many of you knew that. That doesn't mean you can have a cocaine dispensary selling cocaine for medical purposes. It just means that doctors in very, very limited conditions can use it in internal hospital surgical, extreme surgical settings. So it's at least available for that. And by the way, cocaine can be dosed, unlike marijuana. You have to have an individual FDA product for medical use. So if marijuana was, let's see if it's here. No, it's not here. If marijuana was rescheduled today, you also could not sell it legally, federally legally, in a dispensary. You have to have an individual product that is approved by the FDA that you're able to replicate that can then be sold in a pharmacy, and that can happen with smoked marijuana. Now, I have a proposal. This is sort of something that if I was in the federal government, I couldn't argue for this because it's not the law, but now that I'm not, I'm much freer to say these things. Before marijuana-based medications become available, like Sativex, that mouth spray, I am putting forward a plan and saying, let's get the non-smoked marijuana components delivered in a mouth spray. We know how to do it. We were doing it with Sativex now. Let's look at the other components regulated in strength, purity, and composition, so we know what's in it, to get those folks that are terminally ill with cancer or MS, ALS, etc., whose actual physicians, not the doctor they met on Venice Beach that's wearing a bikini and costs $200 for 5 minutes of her time to give you the recommendation, not that doctor, but your actual doctor, to basically, if your actual doctor says nothing else has worked, really the benefits outweigh the risks here, try something that hasn't been approved by the FDA. Let's do that. I mean, we should have that available today. And they should be able to get it from the federal government so that the person that does have true spasticity due to MS, the child that has 250 seizures a day, who if they take CBD, which would not get the child high at all, could relieve those things, let's enroll them into a federal program and research that. We can do that today. We don't need to pass medical marijuana legislation. Again, we don't smoke opium to get the effect of morphine. Why would we smoke marijuana to get its medical effects? All right, let's go. The other myths are shorter. Let's get into the third myth. And I see law enforcement here today. The idea that countless people are behind bars for smoking marijuana. Well, that was a very interesting question to me because you hear that all the time. The war on drugs, if only we legalized marijuana, we would be able to free our prisons. The police could, because they're all going after all those small-time marijuana users. They could actually go after real crimes for once, right? That's what we're told. Well, it's interesting because who's in prison now here in Michigan for marijuana? 0.1% of people for marijuana possession only with no priors. Okay, well, what if they had priors, then they were caught smoking? That would still be a problem. Okay, well, we looked at those guys. 0.3%. Okay, well, what about, sort of you were selling a little bit to your friend and, really you're not like a big drug dealer, you're just selling a little because you're supporting your habit. 0.4%. and then 1.4% for any crime involving marijuana. So, when you look at the statistics and see that, 30% are there for drugs, or it says 40% sometimes, well, they were there for drugs and the robbery that occurred, right? They were there for drugs and they were violating their probation, they were driving 120 and a 60, driving recklessly, and they blew a .12 blood alcohol level. Yeah, and then we found marijuana. But that doesn't mean they're there because of marijuana. Again, these statistics can be easily abused, and you throw them out there in today's 5-second soundbite world, and it's very hard to dispute. I was interested in some other research that other folks have done about in California in terms of risk of arrest for marijuana. They basically found that for every 12,000 joints smoked, there was one arrest. By the way, most arrests, you're given a ticket and sent on your way. You're not seeing a judge. In California, you're not seeing a judge. I'm not sure what it's like here for small amounts, but you're not seeing a judge. In California, you're giving a ticket, like you ran a red light. Usually it's much less costly than running a red light, and it's not on your record. But one for every 12,000 joints. So again, not that. Now, the other issue, well, let's just kind of step back from marijuana for a minute, because again, we hear the war on drugs generally is the cause for the increase in incarceration. If only we released drug prisoners, we wouldn't have, right? You hear that a lot. We wouldn't have the incarceration problem. All right, well, let's look at who's in, again, state is the place to look, because federal is very high-level trafficking. I mean, I have some stats. Federal, 99.8% of federal prisoners are drug offenses for drug trafficking. That's not even marijuana. You cannot find marijuana possession at the federal level. It's too high of a threshold. Anyway, so state level is important. Well, it is true that we had, in terms of compared to other industrialized countries in the late 70s, early 80s, we had an average rate of incarceration. It wasn't actually very high. Well, very, very quickly, for a lot of reasons, due to mandatory minimums, due to non-drug related offenses, etc., we had a huge rise in incarceration in this country from 400,000 to 1.4 million. Okay, that's nothing to be, proud of. That's the fifth highest. That's 5 times higher than our historical average, and about 5 times higher than any other industrialized country in the OECD. Okay, nothing to be proud of. However, well, let's look at the drug offenses. It was drug offenses that drew some of this growth until about 2000. Then when we look at it, and actually if we had the later stats, it would be even lower. It would be around here where the green is. Drug offenses have tapered off and actually gone down in terms of a proportion. So just imagine we took this entire chunk out, we let every drug trafficker out of prison today, in a state prison, we would still have 1.2 million people in prison. In the state level, we wouldn't have 5 times higher than our historical rate, we'd have 4 times. We wouldn't have 5 times higher than any other industrialized country, we'd have 4.2 times higher. So the issue is, I get that incarceration is a problem and we should work on that. How do we prevent crime and reduce those numbers? And we have been harsh for things in the past. Let's be more equitable. But legalizing drugs, all drugs even, actually are not going to take us there. But again, we just never hear that. Let's go to myth 4. The legality of alcohol and tobacco strengthen the case for marijuana legalization. I referred to it earlier about, alcohol. Fights happen because of alcohol, right? Pot never did that. This is peace-loving people smoking marijuana. What's the big deal? You never hear of a marijuana fight. You never see a corner fight of between the two bar owners or beer distributors that are competing in the city. They don't take it out in themselves with Glocks on the street. They deal with it in the courtroom. That's what we should do for marijuana. Then we don't get rid of all that violence. Well, let's look at this first from a public health point of view. We know that the use levels for alcohol and tobacco in this country among a general population way outnumber the use levels for marijuana, right? Remember the first slide, 52%, 27%, and 7% in terms of alcohol, tobacco, and marijuana. The other thing that I want to press upon you is this idea of, all right, well, what if we did legalize marijuana in this country? What would that look like from a business point of view, right? From a legal point of view. We've never done it, so you'll hear people say, well, we just don't know, because we've never done it. Well, we've done it with 2 other substances that are in some ways similar, in some ways different, alcohol and tobacco. So we don't have to guess that much in terms of what that industry in this country would look like. And I'm going to get to that in a minute, but let's just debunk another myth here that we hear, well, kids get beer. You know, you have to show an ID to get alcohol. No drug dealer asks for an ID. That was a very effective talking point in Washington State among parents who voted for legalization. They were bombarded with millions of dollars of ads with that line. I want to protect my kid from marijuana, so therefore we should legalize it because drug dealers don't ID. And for people who don't think about this issue, who are unlike you, who are not working in the issue, that sounds very reasonable to them because they think about a liquor store asking for ID. They think about a drug dealer. Well, when does a drug dealer ask for an ID? And they say, yeah, maybe if we just controlled it, we could keep it away from kids. Well, kids report today that it's much easier to get and much faster to get alcohol and cigarettes than it is to get marijuana. There is something about the illegality that makes it harder to get, that makes it more expensive than it would normally be, and makes it less available. So let's go back to this issue of the industry. Well, you know, let's look at the alcohol industry. Now, I'm not talking about the 80% of people who drink responsibly, who, you know, drink a few beers on the weekend and watch the game, a glass of wine at night before bed or with dinner. That's one thing. But the issue is the alcohol industry, I hate to break it to you if you're one of those responsible drinkers, they don't care about you. I mean, they really don't. I mean, they don't want you, wish ill will, but from a bottom line point of view, from their wallet, you're unimportant, right? The alcohol industry, as I said, makes their money, 90% of their profit, from the 20% of people who drink. The 20% of people that consume that 80 to 90% of the total volume of alcohol in this country. So that means they're very concerned with people who are addicted, and not in the same way you are. Because if you're addicted, that means you spend a lot of money on alcohol. And that's very, very, very important to an industry like alcohol and tobacco, by the way. It's so important that they realize that they got to keep the cost of the product down as much as they can. So the alcohol industry has been extremely successful at keeping taxes lower than you could ever imagine. In fact, when adjusted for inflation, today's tax on alcohol, federal, state, local, is a fifth. 1/5 of what it was during the Korean War. Now, I had to Wikipedia the Korean War when I heard that statistic because I wasn't exactly sure what decade. I didn't think I read that right, but that's the 1950s. And the fact that it's a fifth of what it was tells you the influence of a lobby, that's legal and can have offices and is out there, out and proud, and the strong economic incentive to keep addictive substances as cheap as you possibly can. Now, the tobacco industry wasn't quite able to get away with that because they were basically exposed as totally increasing use, and I'm going to talk about the tobacco industry in a minute. So the tobacco industry is sort of a different point of view, right? Because the taxes on tobacco are very high, yet we still have 27% of people consuming tobacco products. So back to this issue of crime, right? The drug dealers will go away and we can do that. Well, wait a minute. We know that gangs and cartels, they don't make the majority of their money from marijuana. They make between 15 and 25%, according to the best studies, of their revenue. In fact, if we wanted to get rid of cartels, we wouldn't just have to legalize marijuana. We'd have to be prepared to legalize heroin, cocaine, methamphetamine, human trafficking, number one source of income, non-drug income, kidnapping, extortion, political crimes, and bribery. So if we're ready to legalize all of those, we can have a conversation about what we're going to do about Mexican cartels. But if the idea that we legalize marijuana and they're simply going to go and become ice cream men is totally divorced from reality. But again, it's a great soundbite, right? You don't see, Coors out there shooting people in the streets of Chicago. So it's a wonderful soundbite, but it's totally divorced from reality completely. In fact, even in a legal market, where drugs are taxed, because we hear that, if we legalize marijuana, we're going to tax it to pay for schools, pay for prevention. We're going to pay for treatment if we tax it. I'm going to get to why that's flawed in a minute, but let's just assume they were able to do that. Well, wait a minute. You're going to have rules. That means it's going to probably be illegal for those under 21, and you're going to have THC potency limits, probably, 15 to 20%. Well, what about the guy who wants 25% THC or who's 17? There's going to be a black market. The idea that the cartels and the gangs are simply going to pack up and go home after 50 years of establishing themselves in American cities and spending a lot of money and problems to establish those roots. No, they will be there to fill the void. They will be there to sell you that marijuana for $1 less than the state government, who's so proud of its tax rate that it's going to get on it, is going to collect. They will be there and they will be ready to do that. So here's the issue with that actually concerns me the most, really. And we laugh now, but let me tell you, we are on the brink of creating this industry right now. And I'm not, screaming for no reason. We have evidence this is actually happening as we speak. The seeds have been planted for big marijuana. And I ask, can we really trust companies and big corporations who rely on addiction for profit? Again, it's the only way they make money. They don't make money off of you if you're the 60-year-old ex-hippie who wants to smoke a joint at New Year's. They really could care less about you. They want to addict young people, because that's when addiction starts, right? We talked about that earlier. And they have to start you when you're young. And by the way, they're going to go after the most vulnerable in society too, right? The ones that really don't have the social welfare net, the ones that don't have access to healthcare and education, the ones that don't have the family environment that might be able to help them get through their addiction. That's why if I ever talk to Bill Maher on this issue, who is so proud of smoking, he admitted to smoking over 50,000 joints in his whole life, and he says it with a smile. What I'd like to tell him is, that his experience is probably a little different, his upper class privilege experience, a little bit different than folks who don't have that same safety net as he does. So I get that he can do it and laugh and giggle and make millions on TV talking about it and act as a spokesperson for normal. And you know what? All the more power to you. But that was not going to be the same experience as a person living in the inner city with one parent, with all the other social pressures around them. It's not going to be the same experience. So this is the cover of Fortune magazine. They are very proud, this industry, of basically professionalizing the marijuana industry, right? Where we've turned in our tie-dye shirts for our Armani suits. We've cut our hair and got rid of our hemp undershirts. And we're now looking like this guy. And that is really what they say, and they're very proud of it. And it's very smart of them. We have about 3 minutes to go before lunch. We're just getting to the juicy stuff, so it's good. It'll bring people back. And actually, the headline was the Yale MBAs are here, and that's real, right? So again, this is not just a couple of people who played around with this in the 70s and grew a plant for their neighbor. These are people ready and willing and currently creating, in this case, a multi-million-dollar private equity fund called ArcView, you can Google it, that is raising tens of millions of dollars for the new marijuana industry and everything that will accompany it. So they're meeting and talking about it. In fact, the co-founder said business is driving the change. Business is the most powerful platform for political change that's existed. When there is money for government, money for investors, money for entrepreneurs, and benefits to communities, that's a powerful incentive for change. Okay, that is what the leader of this group has done. And maybe we'll break here because the next quotes, what I'm going to talk about is showing we actually literally have the smoking gun evidence linking the tobacco industry, the current tobacco industry, with big marijuana, with what we're talking about. So thank you for listening to me so far. I look forward to, seeing you after lunch. Are they going to go get their lunch?
Well, they should probably wait for some instructions.
Great.
All right. For just a second, I have a few instructions. Did you want to give lunch instructions?
You can then.
Okay. I don't remember them. Oh, okay. Stephanie's going to give you some instructions about lunch.
Real quickly, we're only going to take about a 15-minute break. Lunch is right back here, and we'll have you enter the doors there and then come out over this way, so that way.
Text your answer. And let's welcome Dr. Sabet back up as well.
Question was? Oh, my work's done. I can go home then. All right. I'm on contract. Stay. Okay, let's see. Got two people there to keep it interesting. That's good. I like that. I like that. Robust debate, right? It's important. So, first of all, it's a great lunch. Let's give a round of applause for the conference organizers and the staff for providing that. So we're back here to big business, and the point that there is a big business lobby actually looking at this issue very intently. So I went back and looked at some of the papers. You know, we have now a treasure trove of papers from the tobacco industry that we have as a result of you've all heard of the master settlement of the 1990s. Basically, the tobacco industry in the 1990s was on the verge of being shut down by the government, virtually prohibited, and fines of billions of dollars. Essentially, they cut a deal with the federal government. They said, all right, we're not going to fight taxes. You can increase the taxes to whatever you want. We're not going to advertise in most markets. And the other thing we're going to do is turn over our internal documents to you. Just please, don't prohibit cigarettes. So the government took that deal. Some people think it was too lenient, but they took the deal. And what that revealed, though, was like I said, a treasure trove of documents regarding their business practices. We have an inside look into an industry like we really have never had before. So the first thing I thought was interesting was what was actually said by the second largest tobacco company at the time, Brown & Williamson, which is now part of R.J. Reynolds. Basically said the use of marijuana has important implications for the tobacco industry in terms of an alternative product line. We have the land to grow it, the machines to roll it and package it, the distribution to market it. In fact, some firms have registered trademarks which are taken directly from marijuana street jargon. These trade names are used currently on little-known legal products, but could be switched if and when marijuana is legalized. Estimates indicate that the market in legalized marijuana might be as high as $10 billion annually. Now, this was in the mid-1970s, when the last time in this country we were going down the path of legalization, right? We had 12 states decriminalize marijuana. The president at the time even was supportive of a version of marijuana legalization in the 70s. And so, they thought they were about to legalize it, just like people think right now we're on the brink of legalizing it nationally. So we have evidence that the tobacco industry is involved. And then what I thought is, let's look at what the tobacco industry said about kids, and let's especially look at what they said about kids at a time when they were publicly saying they aren't dare marketing to kids and are not interested in kids. It's only for responsible adults. Don't we hear that all the time about marijuana too? It's only legalizing it for responsible adults over age 21. Well, R.J. Reynolds in this confidential draft basically thinks they thought they were being unfairly targeted and unfairly kept back from marketing to kids because, after all, in their words, less than a third of smokers start after age 18. So 70% of your market share is starting before they're legally allowed to start. That is a key part of this whole thing. And then the memo goes on to talk about Project Youth Cigarettes New Concepts. How can we create a product, they said, that's going to appeal to youth? Well, apple flavor. Apples connotate goodness and freshness. We see many possibilities for our youth-oriented cigarette with this flavor. Sweet flavored. We believe there are pipe tobaccos that have a sweet aromatic taste. It's a well-known fact that teenagers like sweet products. Honey might be considered. Now, I wish I could think that they were, when they said teenagers like sweet, like they meant like 19-year-olds, right? Because those are the one age group, 18 to 19-year-olds, the two ages that are legal within the teenage years, but I somehow doubt that, especially if they just said that their market share, 70% of which are under 18, the people who start smoking. Folks, this is what I worry about with regards to legalization. I really could care less if you're a hardworking, tax-paying, blue-blooded American who wants to smoke a joint once a month in the privacy of your own home. I don't think any police officer, if that's the only thing you're doing, is going to be rounding you up and taking you to jail or prison. But this isn't about the 45-year-old guy without a family smoking a joint in their mom's basement. Okay? Legalization isn't about that guy. All the more power to him. I feel sorry for him. Go for it. I don't care. Legalization's about this. It's about targeting our kids and finding a way to hook them as young as we can. And given all we know about marijuana now, much more than we knew about tobacco in this era, how could we allow that to happen? Another thing I looked at is, well, there were a lot of spokespeople for big tobacco. So my second book, by the way, is, if you could guess, it's basically looking at the tobacco industry for 80 years, the tactics they did, paralleling it to the marijuana industry right now, because they're exact parallels. So the other thing I'm looking at is spokespeople. And I looked at the Winston man. You've all heard of the Winston man, right? The model, the dude that every guy wanted to be like, right? In his late 20s, rugged, handsome, got all the girls, you know, great with a gun, great with a cigarette, great with everything. And, you know, I was interested that the main Winston man, basically in his was addicted to tobacco, cigarettes, right? Loved to smoke. Okay, not that surprising. Well, he said in congressional testimony that one day he was doing a photo shoot, a modeling shoot with cigarettes. They had a lot of props in the back of cigarette cartons that he thought were empty. The shoot's over. He realizes, he shakes them. There's actually cigarettes in them, and he thought, oh, the executives, the executive, R.J. Reynolds execs, they're gonna, I'm sure, take these, right? Because they must smoke. So he says to the executives, it was the vice president for marketing, it was the vice president for external affairs, multiple executives. He said, I take it you guys want to take the cigarettes, right? And they said to him, no, we don't smoke. Man, he said, you know, he's like a major chain smoker. He's their, you know, icon. He's always given free cigarettes by the company. And they said, what do you mean you don't smoke? You don't smoke? And they said, no, we don't smoke the expletive. We just sell it. We reserve that right for the young, the poor, the black, and the stupid. This is congressional testimony that was said. Again, the issue that I have is the fact that it will become a big business. Already the second annual National Marijuana Business Conference is taking place in a month, expecting hundreds and hundreds of people to talk about how to finance and fund this new industry. And so really my question that I lay out to folks who support this, you know, is, do you want big marijuana? Because big marijuana will become the next big tobacco. Remember this? These were the vending machines that sold cigarettes that we fought. Advocates that came before you, most of you, all of you are very young, but the people that were in this seat 30 years ago working on anti-tobacco measures, they spent their whole career making sure that tobacco vending machines were not the norm, okay? They fought the billion-dollar lobby and won. But guess what? This is actually not a tobacco vending machine. It's a marijuana vending machine, and it's not a joke, and I'm not that good with Photoshop. If I was, my picture would make me very, very skinny. That's real. And it's a marijuana vending machine under the guise of medicine, and that company grossed last year $1.5 million. In an environment where marijuana is illegal and medical is supposed to be regulated very, very closely. This is a real billboard for by the way, Real Doctor, I know guys, Real Doctor, selling marijuana for medical purposes in Los Angeles. Okay, this is the kind of thing that we fought against for decades in the tobacco industry. We're now allowing it for marijuana, and it's here. We now have the cartoon character candy of marijuana candy. We have the marijuana flavored sodas, the Pot Tarts. Okay, by the way, this is only for medical purposes. So, you know, Aunt Bethel, you know, dying of cancer here, I guess she's gonna be wanting grape flavored soda with a monkey skeleton on the front and a THC leaf. I mean, give me a break. It's targeted to kids. So, you know, alcohol and tobacco legalization really teach us that there's no money in this for anyone other than big business. In fact, let's look at how much money we get from alcohol and tobacco, right? Because it's all about the money, tax money. Well, I did some research. For every dollar we get in alcohol and tobacco tax today, we spend 10 in social costs. Okay, so anybody telling you that, well, we just need to tax marijuana a little bit, it'll pay for treatment, or even if they make the assertion that tobacco or alcohol taxes pay for treatment or prevention, they don't pay for anything. We lose much, much more with these addictive industries. How's the lottery doing here in terms of public education? Do your public education's all fixed up now? That's why you have a lottery. That's how the lottery was promised in every single state, that it would fix public education. How's that going? I mean, so this is the question we need to ask people and our elected officials. You really think you're going to be paying for the problems as a result of legitimizing another illegal industry? The other thing I hear all the time is, if only we treated it like alcohol, right, there'd be less people, as I said, less people in jail, less people involved in the criminal justice system. Okay, well, I said, well, how do we treat alcohol then? I'm curious. Well, to my shock, actually, to my surprise, when taking out all the violence related to alcohol, okay, that's a separate issue. Battery, domestic violence, murder, alcohol-related violence out of the picture. Just non-violent crimes related to alcohol. What does that mean? That means public intoxication, driving intoxicated, and selling to minors, okay? All things that if you legalize marijuana, you'd have to try and regulate, right? Because we wouldn't want that to happen. Well, 2.7 million people were arrested last year for those alcohol-related violations, non-violent. 847,000 for marijuana. So if we treated it like alcohol, then we must want to have more arrests because we're going to have more problems. This is the issue. When you increase the denominator, in other words, the number of people just using the substance, which you do when you legalize, everything else, the numerators get increased then. The numerators for arrests get increased. The numerator for drugged driving will go up. The numerator for kids that drop out of school, amotivational syndrome, goes up. So when there's more drugs, there are more problems, and that's why we don't want it at all. One of the things I hear all the time is, well, it would help minority communities. Well, yeah, I just spoke at one of the largest black churches in Washington, D.C. the other day. Okay, they weren't too happy when they heard this statistic, which corroborated what they already knew, that there are 8 times as many liquor stores and alcohol outlets in poor communities of color than in upper-class white communities. Well, is that because the upper-class white communities don't have money to spend on alcohol? No. Is that because they don't drink? No. They actually drink at the same rate. If anything, more affluent, you're more likely to drink and, by the way, use drugs. Why do they target? Well, they target these communities because they're the most vulnerable. Like I said earlier, they don't have the safety nets, right? It's much better to target the communities that are going to be more likely to be addicted. So whereas minorities and whites use drugs at around the same rate, look at the addiction rate. It is higher in those communities that don't have the resources. So, by the way, that's where the business goes. The business only cares about you if you're addicted. So the alcohol industry is very happy to go to you in those neighborhoods. Let's go to myth 6. That Europe, Portugal, Holland, you've all heard about, right? The Netherlands, the wonderful experiment. Or Portugal, the wonderful experiment. Well, first of all, neither Holland nor Portugal nor anywhere else in Europe nor anywhere else in the world other than the great state of Colorado and the great state of Washington have legalized any illicit substance right now, currently illicit substance. So Colorado and Washington are undergoing this for the first time in the modern era. Portugal and Holland never did. In fact, in Portugal, what they did was, essentially, if you had a small amount of drugs, they sent you to their version of a drug court, which is a 3-person, they call it a dissuasion panel, trying to dissuade you from using. Okay. They also implemented a lot of treatment. They implemented methadone, all this stuff. And they basically had mixed results. Youth actually had more use because I think there was a perception that it was okay to use. Drug-related deaths went down. Frankly, the impact of the policy is unclear. But what we hear all the time from legalization advocates is, well, if only we could do it like good old Portugal, who legalized. They never legalized, and frankly, again, their results are very mixed. And even if they had positive results, a country of 3 million Catholics versus 300 million people from very diverse backgrounds, that's going to have a little bit of a different outcome probably too. So it's a really false comparison. I love Portugal, by the way. There's nothing against Portugal, but the point is you can't make these comparisons. Dutch policy, an even smaller country, even more homogeneous population probably, especially at the time when they implemented this, they allowed they had the non-enforcement of marijuana laws in their coffee shops in 1976. Frankly, for the first 10 years, they didn't even have that many coffee shops. I mean, it really wasn't an issue. Then all of a sudden, when they started advertising and commercializing, people thought, wait a minute, we can make some money from this. The border towns, the number of shops exploded, sort of like what you have in California with medical and Colorado. They experienced a 3-fold increase in marijuana use among young adults. In fact, today, they have the highest treatment need for marijuana in Europe. And this is a country that legalization advocates say is perfect model because they don't have any problem with it. They have no violence, etc. Well, yeah, they do have lower levels of violence. They do have lower levels of cocaine use. They do have lower levels of heroin use. But guess what? They always did. Okay, America always had higher rates of those issues. So we confuse it when we make the comparisons. The other issue to know is that they're totally scaling back their policy. Anybody been to the Netherlands lately? Did you try to go to a marijuana coffee shop? Because if you did, you'd quickly be turned away. Only Dutch residents now can buy marijuana in coffee shops. They have closed down hundreds of coffee shops. So this wild success apparently hasn't been that much of a success because they've actually been scaling down the policy. And again, that's stuff you never hear. Well, what about other countries in Europe, like jolly old England? The UK, actually, you never hear about in drug policy because they've kind of, in their typical, I lived in England for 5 years, stiff upper lip, low, profile kind of way, basically implemented what we would probably think is very good. They've implemented robust treatment, enforcement is working with treatment and prevention, and they've had major reductions actually in drug use and drug-related deaths. They haven't legalized one drug, they haven't decriminalized, they haven't had coffee shops, they haven't needed any of that, and they've actually had some success. So, we need to be careful when we look at these comparisons. And then the final myth that's presented in the book is prevention, intervention, and treatment are doomed to fail, so why even try? You all know that you're all here, and you know that that is not the case. People can and do recover. Treatment can be, and early intervention in this issue is especially critical. And frankly, we need to train our teachers and our healthcare workers to identify early signs of use to prevent that progression. So let's look at some of the policy implications here. First of all, again, the groups pushing for legalization really have found a way to resonate with everyday people. They have made it about the sick and dying, they've made it about prisons, they've made it about budgets, and frankly, they've organized around U.S. states to push their initiatives. They have major donors who fund their work, and I'm not going to go into the details, but it's multi-millionaires that fund their work. Peter Lewis, who founded Progressive Insurance, those commercials, $40 and $60 million he has spent. John Sperling, University of Phoenix, the most profitable university in the history of mankind. Over $50 million to this. They've secured champions really at all levels. They have the attention of the media. Frankly, this whole issue of Sanjay Gupta, I didn't want to go into too much detail, but I was asked on the break by some, you heard that he had the documentary. Well, before the documentary, CNN promotes it as, Gupta changes his mind on weed. Like, wow, it made a major change in his thinking on weed. And he used to be against it, and now he's not. Okay, well, I watched with trepidation a little bit this documentary. Well, what did I see? I didn't see Gupta change his mind on weed. I saw that he found that a little girl who had seizures benefited from a CBD oil mixture, which had nothing to do with a joint, and yet it's promoted as weed is the miracle drug. So why do we think kids are getting the wrong impression of this? Probably because most of them saw the headline or read it on Twitter, but didn't even watch the actual documentary. Because if you did watch the documentary, you saw that Sanjay Gupta did not say that this little girl should be smoking a doobie. They said she should be getting a non-smoked, non-psychoactive component of marijuana that frankly is very difficult to find, but they found it in Colorado. But again, it's a PR game, and once again, the legalization movement wins the PR day because this is the headline that people run away with, that the respected doctor has changed his mind. They've mobilized major grassroots and student supporters, and basically they've said that if you're not in favor of legalization right now, you are a backward-thinking Neanderthal, old-fashioned, get on the train or get off of it. And they love making the comparison to gay marriage. And that's like the new favorite thing. It's like, marijuana is the new gay. That's what Bill Maher said. There are so many implications with that. I don't even go there. But, but the one thing to think about is, wait a minute. Okay, wherever you stand on the gay marriage issue, in many ways, that is a civil rights issue. That is an individual issue. Yes, it's a symbolic issue about the sanctity of marriage. I get that. But marijuana is not an individual civil rights issue. It's a health issue. Your marijuana use affects me. Whether it's in healthcare costs, whether you're driving my kid to school, if you're my kid's teacher, if my kid is using marijuana, it will affect you if you are his classmate. That affects you. Gay marriage, I don't think I've been convinced by the argument that if somebody sees someone else's, getting married to someone of the same sex, that's going to make them want to be with someone of the same sex. I mean, that doesn't make sense. But they have used that to basically say, get on the train or you're old-fashioned, get out. And we have to push back against that. Those of you who are social workers who see the devastating effect every day that this drug can have, doesn't always have. This isn't about reefer madness, right? I'm not saying that you smoke a joint and you become a heroin addict. But basically they say that if you don't believe in legalization, that's what you must think. That if you smoke a joint, you think that if a kid smokes a joint, they should either go to jail or they're going to become a cocaine or heroin addict. And that's totally obscures the seriousness of this issue completely. So, right, I mean, they basically unprecedented levels of support for legalization here, over 50%. Now, after 50 years of trying, they have done it in 2 states, like I said, Colorado and Washington. How many of you heard about the guidance from the Justice Department 2 weeks ago? Right, Eric Holder basically said, we're not going to sue these states in court. We're going to defer our right to do that. It is against the law, but we're not going to challenge you yet. And we're going to kind of see what happens as a result of this. And then, then we might go after you. Well, the Attorney General laid out major areas of importance, including youth drug use, drug driving, advertising, et cetera. But as I argued in front of the Senate panel 2 weeks ago to Chairman Leahy, this has already happened, right? We don't have to wait for legalization to happen. We've had legalization in a place like Colorado for the last 2 years. What do I mean by that? Well, they had medical in 2001, but they didn't have dispensaries until 2009. So basically for 8 years, they kind of had this very murky thing. You could sort of bring up a defense. If you got pulled over by a cop, you could sort of show them your card and you might get off, you might not. Well, but in 2009, they started saying, wait a minute, like the Netherlands did, wait a minute, we can make some good money out of this. And all of a sudden you had more dispensaries in Denver than you had Starbucks. That's true. And so it went from 0 to 532 in a matter of about 2 years. And you went from 1,000 people with a card that looked like, basically, like I said, the New Mexico program, Rhode Island, very small program, to 108,000 at least that had a card. That doesn't cover everybody who's using this from, with the medical defense. So you had an explosion, and you basically had the de facto legalization of marijuana. And what have the effects been? We can look and see. Well, now Colorado has become the 5th highest in the nation in terms of a state. It's 50% above the national average for use. Drug-related referrals for high school students have risen over 150%. In 2007, tests for positive made up 33% of all drug tests. Now they're 57% of all drug tests. What about medical marijuana being diverted to youth? Well, shockingly, this was unbelievable. That, in fact, a member of our board of SAM was the physician who found this out. 3/4 of Denver youth in treatment reported that their marijuana came from a medical marijuana dispensary. That was supposed to be for quote-unquote medical purposes, that either they got or a friend got. So we've had the diversion to youth. We've had the youth increases. If Denver was an American state, it would have the highest state level of marijuana use among kids in the country, if the city of Denver was that. And they're about to now license dozens of stores. They already have dozens, hundreds under medicine. Now they figure out recreation. I won't go, on and on. The traffic fatalities that have increased. What's amazing is that total car crashes in Colorado have gone down from 800 to about 550. What about crashes with high drivers? From about 25 to about 60. So at the same time you had a reduction in all drivers, you had an increase in pot drivers. ER visits have gone up. On and on, I won't continue. But this is interesting. Under 5-year-olds going to the ER for unintentional marijuana poisonings. Basically getting their hands on a brownie. They've never had THC in their brain like that before. Now all of a sudden you're going to give them a 20% concentration of THC in a brownie? That's going to mess them up. Thankfully, there was no death as a result, but it was acute hospitalization. So there have been there's been diversion to other states. One of the things the Justice Department said is we're going to make sure it doesn't leave the borders of Colorado. Well, it already is. Every neighboring state now has Colorado pot. So this has become an issue. And then finally, the end of this was that there were 2 independent reports basically saying, by the way, we don't know what we're doing when it comes to medical marijuana. The Colorado State Auditor said that the state had not established a system for medical marijuana. The cash fund was out of compliance. 50% of all recommendations by 12 doctors. That's hundreds of thousands of recommendations. Okay, by the way, doctors don't want to be a part of this, but a couple of them do. You make good money, but by and large, doctors don't want to be a part of this. The city of Denver said that the city does not have a basic control framework in place for medical marijuana. Our records are incomplete. This is their own city audit. Incomplete, inaccurate, inaccessible, and that many dispensaries are operating without licenses. So how on earth are we going to be able to legalize it in a way that we can actually have some accountability when these states are not ready for it? The so-called peaceful rally at 420 in Denver turned into a shooting spree. The shots fired, 2 people were actually shot there in Civic Park on that day. This was the 420 rally in San Francisco, because I thought there was a correlation between like caring about the environment and some of these things. No. That goes out the window when you're stoned, I think. I mean, so again, making it out to be like this is just about adults, responsible, able to smoke a joint a few times a week, and that's not what this is about. It's about something much bigger. So now we know it's on the ballot in 10 more states. It will be on the ballot in about 10 more states coming up in the next couple of years. The Marijuana Policy Project has announced that. Alaska's next year. And then it'll be a bunch of states in the next 2 or 3 years. And it's millions of dollars being spent on this lobby. So what are our choices? Kind of sort of ending with some of the policy stuff more generally for all drugs. We, I think, are being sold a false dichotomy in this country about drug policy. We're being sold the false dichotomy of you either have to prohibit, in other words, incarcerate people for small amounts of marijuana, or you have to legalize it, or really small amounts of anything, or you have to legalize it. And those are our only 2 choices. And really, I reject that dichotomy, right? That is not looking at this from a public health point of view. I don't see why either of these are good policy choices for us dealing with such a complex health and social issues. So I think it's not about legalization or incarceration. We can be against legalization, but also be in favor of public health, right? We can also be in favor of education and common sense. So that's why we started Project SAM. And actually, Patrick's name is on there, but it's interesting because you had Patrick on the left, clearly, son of Ted Kennedy, and then you had someone named David Frum from the right. And David Frum, actually, you don't know the name probably, but you know the 3 words he's most famous for coining when he was George W. Bush's senior speechwriter, the term axis of evil. I never thought I would see the guy who invented the term axis of evil and Patrick Kennedy, the son of the liberal lion of the Senate, standing together on a podium about any issue. But they came together on this issue. And it's this right-left coalition, basically with public health experts from Harvard, University of Kansas, Denver, et cetera, on the board trying to guide this. We're trying to guide marijuana policy in a much more robust way. And basically, we want to get the science about marijuana out there to the American people. We're not ignoring the fact that drug policy is not perfect. We need to have a conversation about consequences of arrest. That's fine. But what we don't need to have when we have that conversation is big marijuana, is the legalization of really any drug, but especially marijuana. And we also want to promote the research, like I talked earlier, into the components of marijuana for medical purposes, not, sort of raw marijuana as medicine that's out there. So we're a national group with state and local partners. You can see all these on our website. That's David, that was Patrick. This is a woman who is responsible for the most used therapy for tobacco cessation. She doesn't want to see another big tobacco either. So there are a lot of things other than legalization that I would end with that we can do to change current policy and make it better. Let me just fast forward through this, because I want to do. So there are, like I said, alternatives: prevention, treatment, recovery, smart enforcement, international efforts, parents. We know that parents' involvement is huge when it comes to preventing substance abuse, right? That kids that have parental involvement in their life are much more unlikely to use than kids that do not have parental involvement, okay? So parents have a huge role in this. Now I want to go back in time a little bit to the mid-1980s, the time when we were kind of about to surrender to the crack epidemic. Okay, this was sweeping through the country. It was a huge issue. You had, cocaine used by sort of affluent types and Wall Street, et cetera. Then it became very scary when it was turned into crack, and there were a lot of other subtexts attached to that. And this actually was the reason for the birth of the modern coalition movement in this country today, actually. And community coalitions came about because people said, wait a minute, having a classroom exercise about the dangers of drugs once a year probably isn't going to cut it for the kid who's walking home past 3 open-air drug markets on his way home from school. Or, the fact that this was becoming in our communities, and this was being plastered in the media constantly left and right. So basically the idea of let's get multiple people around the table, from law enforcement to treatment to prevention to social workers to teachers to parents to religious groups to business leaders to civic groups, on and on and on, together to come up with a local plan, looking at our local data to attack this issue in really a robust, multifaceted way. So that's how community-based prevention started, and it works. We know that in communities with community-based prevention, in places where they actually have these people around the table, they have lowered, and this is all peer-reviewed research, lower alcohol, marijuana, and tobacco use compared to communities that do not have it, that simply rely on a couple of classroom exercises for drug prevention. Okay, that's really the old way of doing drug prevention. That is not the modern way that we should be adhered to. Early intervention, physicians. We have to involve physicians if we want to think about this as a health issue. Imagine if we treated another health issue in the same way we treat like small-time marijuana use. So usually if you have a little bit of marijuana, you're given a ticket and told to go on your way, or it's kind of like, we're not going to deal with it right now. Imagine if we treated cancer like that, early stage cancer. That's a health issue, right? Early stage cancer, you come in to see the doctor, you have signs of very early stage cancer, and the doctor says, you know what, come back, I'll deal with you when you're at 4th stage, when you need intense chemotherapy. Then I'll deal with it, and it'll be expensive, and we'll sort of cross our fingers and hope that you can recover, but I don't have time for that right now. I only want the worst, only want the far end of the spectrum. Imagine if we did that for cancer. We would never do that. We would prevent it from progressing. That's what we have to do with all drugs, especially marijuana, a drug that early use seems like it's harmless. We have to prevent that from progressing, and we have to intervene early. That means our physicians, especially our pediatric physicians and others, have to get involved early. And I think recovery is a huge sort of untapped resources, that there are millions of people living drug and alcohol free today that once felt hopeless, that now are hopeful. They need to be out of the shadows, so to speak. I agree with the 12-step principles of of the anonymous principles. Totally agree with all of them. I have been to sessions. It's remarkable what is done and said and how it transforms people. But I feel like we need to become a little bit less anonymous when it comes to a movement advocating for policies and cultural shifts regards to drugs. Otherwise, it's going to be under the rug again for another generation, and it's going to continue to be an illness of stigma and shame when it should not be. So I love the 12-step principles, but we need to come out of the shadows from a policy level so that folks hear that people can and do recover. This is not a hopeless disease. Enforcement, the criminal justice system is a huge untapped resource, in my opinion. Right? These are 7 million people in this country are in our criminal justice system. 2 million are behind bars, and 5 million are living among us. Probation and parole? Well, the issue is they're the same 7 million that recycle in and out of the system over and over again. They're known to law enforcement. I was talking to a chief on my way here about, in a small town, who do you see the same people, you probably, yeah. And so the issue is, if we know who these folks are, and we know that, a third of them and a fourth of them, depending on state or federal, commit their crimes under the influence of drugs. We know that like 50% of them probably have a drug problem, even if they didn't even commit a crime under the influence of drugs. That means that is a huge opportunity for us to intervene while they're in our system to get off of drugs, whether it's treatment or whether it's a probation program, whether it's something like a drug treatment court or reentry program, getting them to get ready to get back into the community. This is, an example of a drug court. This is the same person here. These things, miracles do happen in our field. And a drug court is simply the marriage of public health and public safety. We're not going to put you behind bars or give you a record, but you have to go to treatment. And we know that addiction is a very complex biobehavioral disorder, okay? So that's why there's this huge debate. Again, it's a black and white debate. Is it a disease? Is it not a disease? You know, it is a brain disease. It's not a brain disease. I see changes in the brain, so it must be a disease. You know, my friend who was addicted, when all of a sudden he decided not to, he didn't seek treatment and he stopped, so it's not really a disease because he stopped on his own. Okay, there's this total false dichotomy with regards to addiction. The reality is that it's a very nuanced picture, and we know that, yeah, in many ways it is a biological change that you undertake, but you're not a slave to it completely. That people, like I said, can and do recover, and things like a drug treatment court, which we're not going to get into the details of what that is, but essentially using carrot and stick methods can help people recover, and it saves a ton of money when we do that. I don't know if many of you have heard of Project Hope, a probation program in Hawaii. In the 1990s, Hawaii had one of the worst methamphetamine problems in this country. And one judge there kept seeing, again, the same people cycle in and out. And basically what Judge Steve Alm, what he saw was, guys coming in, problems with meth, and he basically would give them chance after chance. It'd be like a small amount or they didn't have room in the prison. It was like, couldn't incarcerate them. So he said, I'm going to put you back into the community and, I don't want to see you again. Well, he would see them again constantly. And by the 10th time, he would say, you know what, my hands are tied. Statutorily, you get a 5-year mandatory minimum. I'm sorry. And it was like, hey, I gave him 9 chances, but he didn't change behavior. And he realized that made about as much sense as if you were a parent and you said to your son, Johnny, if you don't clean your room in the next hour, there's a 50% chance that in a year, I'm going to ground you for 2 years. That was the probation system over there, and frankly, in a lot of places. There just isn't the case. Rather than, Johnny, if you don't clean your room right now, there's a 100% chance that in the next hour, like right now, you will be grounded for a week, and you will not go to the movies with your friends that you wanted to go to tomorrow. Okay, Johnny will clean his room with that threat, because that's an immediate threat right there. And it's credible. It doesn't have to be super severe. Whereas we have become accustomed to severe but random sentencing. And so when it's random, it doesn't have credibility. So the guys that, when Judge Alm was seeing the guy for the 8th time and said, if you come back again, I'm going to put you in prison, he'd come back, he wouldn't go in prison, back and back. Then finally the 10th time, he'd say, okay, well, I warned you in 8 times, and you didn't change, so now I have to give you 5 years in prison. That's not an effective way. So he turned it around. He said, all right, you know what? Forget about this 9 chances. You get 1 chance, and I'm not going to put you in prison for 5 years. I'm going to put you in jail for 2 days. But it's a very unpleasant experience to be in jail for an hour, let alone 2 days. So I'm going to see if that changes behavior. Long story short, and you should read about it on the web, Project Hope, they saw an 85% reduction in meth use. And the people that didn't reduce their meth use, the probationers, they actually had motivation to go to treatment. But they didn't all need treatment. Some of them needed frankly, the incentive not to go to jail, even if it was the first time they made a mistake. That's just one idea. There are many other kinds of probation reforms that I think we should focus on. 5 million people in our country in probation, most of them with a drug problem. I mean, that's low-hanging fruit. I talked about reentry a little bit. We have become accustomed to folks serving their time and then getting back into the community, and then we're expecting them to be, proper, upstanding citizens with skills, and they should be fine, right? They serve their time. Well, no. They don't have the skills. They're not educated. They're in communities that don't know how to deal with them. We have to focus on preparing people to leave the jail cell, the prison cell. And a lot of states have done that very effectively, very conservative states as well, conservative and liberal. States like Texas, Justice Reinvestment Program, if you want to look up Justice Reinvestment, they basically said, the state of Texas said, okay, well, given our statistics, we have to build next year a $600 million prison, because we just know, given the cycling, that's what happens, and we don't have room in our prison. And a judge said you cannot overcrowd your prison, you have to build a new one if you want to incarcerate these people. So they were about to build a $600 million prison, and then someone had the idea of, wait a minute, what if we just invested like $100 million, $150 million in education, job training, properly getting these people ready to go into the community so they don't have to get rearrested and go back to prison? Let's gamble on that. And the legislature said, yeah, we don't have $600 million anyway, so we really have no choice. So the legislature of Texas did that. They invested about $150 to $200 million in job training and economic opportunities, housing placement. I mean, where you're placed for housing has a huge effect on whether you're going to use drugs or commit crime. What your complex looks like has a huge effect on that. All these factors, they're big factors. And what happened? They didn't have to create another prison in Texas. And that was 10 years ago, and they still haven't. Because that reentry, the specific things that they did to get those people ready to go into the community actually worked. So these are all things that don't fit on a bumper sticker, right? They're not as easy as saying legalize or lock them up or whatever. They're just, they don't fit a slogan. You haven't heard me say the term war on drugs. I don't think that's a proper, I don't think that really describes our efforts. It's much more nuanced, doesn't fit on a bumper sticker, but these are the things that actually work. It's hard work, good drug policy, getting people to stop like you all do. Preventing drug use is hard, difficult, nuanced, lengthy, confusing, contradictory, mind-boggling work. But it's really important work, and it's much more effective than falling into this societal dichotomy of legalizing or locking them up, which is not where is not gonna take us where we wanna be at all. So that's all I have to say for you today. Thank you so much for listening to me. If you have any questions, feel free to email me, kevin@learnaboutsam.org, or my website. You've been a wonderful audience. Thank you. Oh, do we have time to take questions? Great, wonderful. Oh, it doesn't matter. Anybody.